So chronic lymphocytic leukemia has had a very exciting number of developments here at ASH 2018. We saw in the plenary session a randomized phase 3 study which compared ibrutinib to ibrutinib rituximab to bendamustine rituximab. And then in the late-breaking abstracts, we're going to have a presentation of ibrutinib rituximab versus FCR, what's long been considered a standard therapy in chronic lymphocytic leukemia. We had a press release shortly before the meeting looking at a phase 3 study of obinutuzumab venetoclax versus obinutuzumab chlorambucil, and then we have additional data on combination biologic therapy with ibrutinib venetoclax and venetoclax. These are 4 very large, important trials for the first-line management of chronic lymphocytic leukemia. Starting with the comparison to chemoimmunotherapy. So ibrutinib versus bendamustine. A couple things we learned from this study, and this was in the plenary session. So we learned, number one, that rituximab does not add to ibrutinib. So ibrutinib does not need rituximab partnered with it in frontline CLL. The second thing we learned is that ibrutinib has a significantly improved progression-free survival compared to bendamustine rituximab in patients age 65 or above. And so bendamustine rituximab is probably the most commonly utilized regimen for patients with CLL. And we now know that ibrutinib is probably more superior. If you break that down into 2 different groups, there's CLL that has what's called a mutated B-cell receptor and those who have an unmutated B-cell receptor. And unmutated tends to be less favorable. And the superiority of ibrutinib to that population is very clear-cut. For the more favorable population, ibrutinib looks to be an improvement over the mutated CLL, but there's still potentially room for chemoimmunotherapy. In the younger population, up to age 70, a trial is going to be reported on Tuesday comparing ibrutinib rituximab to FCR. And we see in the younger population an even more clear-cut benefit of ibrutinib over a standard chemoimmunotherapy regimen such as FCR. This study actually shows some survival benefit as well, whereas the other study had only shown progression-free survival. So I think that it's hard to justify FCR with the attendant toxicities of an intensive chemoimmunotherapy regimen. Then, when we move to the press release of obinutuzumab venetoclax, here we have a biologic doublet of fixed duration therapy that's going to lead to FDA approval of this regimen. And what's really appealing about this is it's 12 months of therapy as opposed to sustained treatment in the case of ibrutinib. So I think this is going to be a very appealing option for a number of practitioners. The final study with additional data is the combination of ibrutinib venetoclax, 2 biologic doublets, an all-oral regimen, very high levels of efficacy. It's going to be some time before that regimen is FDA approved, and so it remains to be seen if patients can do that either outside of a clinical trial or if insurance will pay for it. But there are some very large clinical trials launching with that combination.